So here we are at ASRM in Denver. I want to introduce you to a colleague of mine, Dr. Fady Sharara. He's from Reston, Virginia. Fady is near and dear to my heart because many years ago he had one of the highest success rates using frozen embryos in vitro fertilization. To do frozen embryo transfers, we need to prepare the woman with progesterone and estrogen, and he was always a proponent of intramuscular progesterone, the injections. We tried to get away from them, but he insisted on the intramuscular progesterone. Well, it turns out earlier this year, a very important paper came out showing significantly higher pregnancy rates with intramuscular progesterone. So Fady was right all these years. Would you like to tell us a little bit what made you stick with intramuscular progesterone?
So I've always thought that the first pass effect when you give vaginal progesterone may not be enough. Now that the big study from Shady Grove, actually, they're presenting some more data. It's one of the prize papers this year. We did a study with 3 arms, vaginal only, intramuscular only, and then vaginal plus intramuscular, whereby the intramuscular is given every third day.
Every third day.
So that gives the patient at least a break. And in the interim analysis, they found out that the vaginal arm had a 50% lower chance of a pregnancy compared to the intramuscular or the vaginal plus intramuscular every 3 days. So they stopped that arm. They continued with the other 2 arms, and what they're presenting, I think today, is the fact that both the intramuscular every day or the intramuscular every third day plus endometrium twice a day has identical pregnancy.
Still comparable, so we give them a little break.
You give them a little break. So if they can't tolerate the intramuscular every day, then you do, you give them every third day, and that gives them a break.
You're still giving 50 milligrams, standard 50
milligrams, that's it. So I changed my protocol about 9 months ago. What I do now is I give them intramuscular progesterone plus endometrium. But I start the endometrium a day after starting intramuscular progesterone.
So you start out first day, you get 50 milligrams.
50 milligrams, and then the next day in the morning you add endometrium twice a day, vaginally. And I have seen about a 10%
even higher
with this approach.
So you give 5 days completed progesterone transfer on day 6.
On day 6, exactly. And then on the morning of day 7, they start taking the endometrium in addition.
In addition to it. Fantastic. And you don't give glucocorticoids anymore? You never did that?
No, not with FETs.
Not with FETs?
Yeah, I mean, there's no data that shows that it makes a difference anyway. So we don't.
Fantastic. Well, Fady, thank you so much. I regard Fady as one of the kings of frozen embryo transfers. I've really admired his work for years, and I really appreciate you speaking with us today. Thank you, my friend.
You bet. Thank you.
I hope you found this video helpful. Please like us on Facebook, subscribe to us on YouTube, and follow us on Instagram.